Doctors were completely shocked when advanced brain scans revealed unusual movement inside a patient's skull during what was supposed to be a routine neurological checkup. What they discovered would soon challenge their skills and precision like never before. At first, doctors suspected simple inflammation or a minor infection, something treatable with medication. But when the imaging was enhanced and magnified, strange moving shapes appeared within a sensitive region of the brain. Instead of performing traditional open brain surgery, the medical team decided to use a minimally invasive endoscopic technique that allows access through the nasal passage without opening the skull. Using a high-definition microcamera mounted on a flexible endoscope, surgeons carefully entered through the patient's nose, navigating one of the most delicate anatomical pathways in the human body. The entire procedure was displayed in real time on a massive, high-resolution monitor, allowing every specialist in the room to observe even the smallest detail clearly. The nasal cavity provides a narrow but direct corridor towards certain brain regions, making it possible for skilled surgeons to reach deep structures without external incisions. Because the brain controls breathing, movement, speech, and memory, even the smallest mistake during this procedure could cause serious and permanent complications. Earlier MRI and CT scans had strongly suggested the presence of parasitic organisms lodged within brain tissue, something extremely rare but medically documented. Brain parasitic infections can occur when microscopic larvae enter the body through contaminated food, unsafe water, or poor hygiene conditions. As the camera moved slowly forward, faint movement became visible on the monitor, confirming the doctor's suspicions. Clustered together were tiny worm-like organisms embedded in the inflamed tissue, creating pressure inside the skull. The surgical room fell silent as the team carefully evaluated the safest approach for removal. The patient had been suffering from severe headaches, blurred vision, and episodes of dizziness for months. Over time, these parasites had likely traveled through the bloodstream and reached the brain. The longer they remained untreated, the higher the risk of neurological damage. Ultra-fine surgical instruments were gently inserted alongside the camera to begin extraction. Each tool was specifically designed for micro-level precision inside highly sensitive areas. The first parasite was carefully grasped using miniature forceps and slowly removed. The team watched closely to ensure no surrounding tissue was disturbed. After the first successful removal, more movement was noticed deeper inside. One by one, additional parasites were identified and cautiously extracted. What doctors initially believed to be a small cluster turned into a far more extensive infestation. The extraction count quickly rose beyond expectations. Dozens became hundreds as the procedure continued hour after hour. Each removal required steady hands, perfect coordination, and intense concentration. Strict sterile protocols were maintained throughout to prevent secondary infection. Every extracted organism was collected for laboratory examination and confirmation. Despite the complexity of the operation, the patient remained stable under continuous monitoring. Gradually, the affected brain region began to appear clearer on the monitor. Swelling started to reduce as pressure inside the skull decreased. Still, careful inspection revealed more organisms hidden within folds of tissue. The team remained calm and methodical, knowing rushing could cause harm. 600 parasites were removed, then 700. The number approached nearly 1,000 as the final stage began. Every corner of the affected area was re-examined multiple times. Finally, no further movement could be detected on the screen. A final internal scan confirmed the infected region had been successfully cleared. The surgical instruments were slowly withdrawn through the nasal passage. Because the approach was minimally invasive, no external scars were created. The patient was moved to recovery for close neurological observation. Within days, symptoms improved dramatically.
Headaches reduced, coordination improved, and mental clarity gradually returned. Medication was prescribed to eliminate any microscopic remnants and prevent reinfection. Doctors emphasized the importance of hygiene, safe food preparation, and clean drinking water. This extraordinary case demonstrated the power of modern medical technology and surgical expertise. Through patience, precision, and advanced techniques, what seemed impossible became life-saving reality. Medical science continues to push boundaries, turning frightening diagnoses into powerful stories of survival and recovery.